And now this CBS 4 News Health Alert. Early detection has saved the lives of millions of breast cancer survivors, but the treatment that many women have gone through can cause other issues, including heart trouble.
Yeah, in fact, heart disease is the #1 cause of death among breast cancer survivors. But now a new specialty called Cardio-Oncology is emerging to give breast cancer patients their best chance of long-term survival. 4 months into her fight against stage 2 breast cancer, Andrea Ciafani learned that she had a new health challenge to conquer. After recovering from a mastectomy, Andrea received chemotherapy to attack her breast cancer, not knowing that it was also attacking her heart.
It was a little bit of a surprise, especially because I wasn't feeling anything.
An echocardiogram revealed the 40-year-old was in heart failure and was among the tens of thousands of breast cancer patients who develop heart disease every year. Dr. Chow Dang is Andrea's oncologist at Memorial Sloan Kettering. She teamed up with a cardiologist, prescribing medication to protect Andrea's heart so she'd be strong enough to finish her chemotherapy.
So the field of cardio-oncology is a field that is growing. I think we're all working very well together to take care of our patients, not only to improve their cancer outcomes as they survive, but to improve their cardiovascular outcomes as they age.
Breast cancer treatment puts the heart at risk in several ways. Chemotherapy can damage the heart muscle that pumps blood, leading to heart failure. And radiation can disrupt normal heart rhythm and damage both the lining around the heart and the heart valves. But the biggest risk from radiation is the development of an early and accelerated coronary artery disease, which raises the risk of heart attack. While some women have no symptoms at all, others experience shortness of breath, chest pain, or the decreased ability to exercise.
What we should not be telling our patients is don't get the very treatments that make you beat the cancer in the first place.
Dr. Javid Mosleli directs the Cardio-Oncology program at Vanderbilt University.
The treatments are effective, but now the issue is how do we give the drugs more safely?
Can you guys take off your shoes? Just like
3 years after completing treatment, Andrea's heart is strong again, but she will be monitored for any lingering or delayed effects from the chemotherapy for the rest of her life. And doctors now routinely give patients a detailed record of their chemo and their radiation protocols to keep for future monitoring.